Hi everyone, I'm En. Today I'm going to share with you one of the mental illness disorder, which is Obsessive Compulsive Disorder. Do you know that OCD affects 3% of the world population? This OCD can start anytime from preschool to adulthood. And this is typically happens for the age 20 to 24. There are many different forms of OCD, and it can be differ from person to person. And the causes of the OCD until now is still unknown. But it can become better when diagnosed early. So what is OCD? OCD is an anxiety disorder that the person has recurring thoughts or images or repetitive behavior that they are unable to stop them. The person may try to suppress this type of thoughts and also the behavior, but they are unable to do so. Meaning, the individual knows that the thoughts and the behavior are irrational and excessive, but they feel powerless to stop them. Actually, there are specific criteria to be clinically diagnosed as obsessive compulsive disorder. First, the person with anxiety disorder is present with obsessions and compulsions. Besides that, they are having ego dystonic because they realize that those thoughts and also the behavior are irrational and excessive. The people with diagnosed as OCD, they must at least more than 1 hour a day, and those thoughts and behavior must disrupt their daily routine. So what are the symptoms of obsessions? The people with OCD is having repeated thoughts of contamination. For example, they are fear in touching objects. Next, they will also have repeated doubts. They are worried if something is not done properly. And also, they need to have things in a certain order because they will feel intense anxiety when something is out of their place. And they will also thoughts about aggressions, for example, in hurting their loved ones. The symptoms of compulsion include washing and cleaning. They will excessively washing their hands or doing house cleaning. Next, counting. They will also counting the number of times when something is done. They will also keep checking. For example, they will keep checking over and over again to make sure that the door has locked properly. They will also having repeated action. For example, they would like to go in and out of a door or up and down of stairs. And ordering. They will keep arranging or rearranging the items such as clothes, books, and other. The clinical features of obsessive compulsive disorder includes obsessional thoughts, obsessional rumination, obsessional doubts, obsessional impulses, obsessional rituals, and also obsessional slowness. The first cycles of OCD is start with obsessive thoughts. With these obsessive thoughts, they will feel anxiety, fear, and worry. So in order to ease those emotions, they will start doing the compulsive behavior. After doing those compulsive action, they will feel relief. But this relief will only last for a few minutes, because after that, they will start repeating their obsessive thoughts. And this cycle is keep repeating. OCD found excessive with other disease. For example, depression and schizophrenia. And depression is the most common disease in OCD. Many people with OCD suffer from depression, and this makes the OCD symptoms worse and more difficult to be treated. People with OCD commonly diagnosed as schizophrenia. It makes the people hard to separate obsessions from delusions. And actually, there are rare cases to be completely treated of the OCD people. Most of the people have the symptoms relief after they are having the treatment. And the treatment depends on the problems and also the patient's preferences. So the most common treatment includes cognitive therapy, behavioral therapy, and also medication. One of the most famous treatment for obsessive compulsive disorder person is cognitive behavior therapy, CBT. So the therapist will change their way of thinking to deal with their fears. Besides that, the therapist will also help them to change the way to react to the anxiety-provoking situation. So, they will try to talk with the therapist to discover the causes, the anxiety, and how they deal with the symptoms. They will also slowly learn how to tolerate with the anxiety associated with not performing rituals behavior. They will also learning the cognitive strategies to deal with the anxiety, and they will gradually expose to their fear object. That's all for today's sharing. I hope this video will help you to have a better understanding about obsessive compulsive disorder. Thanks for watching. Bye.